The risk factor model is an extremely well-developed model, providing a specific overview of factors being identified by experts within stoma and skincare that may lead to peristomal skin complications. By using the risk factor model, the healthcare professional will be guided in assessing critical areas to consider to preventing peristomal skin complications. When looking in the literature, it is evident that several qualified initiatives have been performed over the last 5 to 10 years to develop a common terminology for peristomal skin complications. However, the success rate has yet not been reported. The studies have the same issues in common. They are focused on identifying common denominators for peristomal skin complications already present. It seems to be representing a reactive approach. In this project, we decided to change the perspective to a proactive approach and look at any risks that may lead to peristomal skin complications, which could be a poor fit to body. Hence, be able to prevent these from happening. The risk factor model supports a consensus-based way to prevent peristomal skin complications by highlighting optional risks to consider, enabling mitigation of the consequences. We hope to increase the awareness of the need to be proactive, thus optimizing resources and improve the lives of people with a stoma. Obviously, increasing knowledge and expertise of the healthcare professionals will help all people with a stoma for better premises. To simplify, we are aiming for raising the standard of living or quality of life for many people dependent on stoma care. The fact that this is a concrete model that can guide healthcare professionals and people with a stoma to get a better overview of risks, which could be a stronger focus on the right fit to body, and thereby empower people to live the lives they want without worrying about leakage and skin issues. This project was initiated in 2018. The idea emerged from the fact that people are still suffering from leakage and skin issues, despite a flow of new products and services on the market, informing us that we must change the perspective and the approach. You may ask, why develop a risk factor model regarding peristomal skin complications? We did that to identify risks of peristomal skin complications to guide practice in stoma care. We wanted to enable healthcare professionals to identify any risks that may lead to peristomal skin complications and hereby preventing peristomal skin complications from occurring. We defined the following hypothesis. Despite great stoma product innovation and development, claiming to help managing peristomal skin complications from all manufacturers on the market, peristomal skin complications are still prevalent. The prevalence is influenced by many variables that must be identified. In 2018, a skin expert panel was established to guide the process. 4 experts in stoma care, 2 dermatologists, and 1 professor in wounds was seated in the panel. The Coloplast Global Cough Group was involved in the process, validating input from the skin expert panel. Validating the model through a modified Delphi process in 2 steps, involving approximately 4,500 healthcare professionals from Europe, Asia, Americas, Africa, Middle East, and Oceania. We reached 100% consensus, and the model is hereby ratified. The model will be published in a peer-reviewed journal during 2021.
When a stoma care nurse meets with a patient, 70% of the time it's because of skin complications and leakage issues. These are critical issues that call for treatment or stoma management. What we need to practice is prevention. What nurses focus on will be key to solving, treating, and ultimately preventing skin complications. What if prevention can be achieved by assessing the risks associated with peristomal skin complications? By understanding and identifying the risks that may lead to peristomal skin complications, stoma care nurses can become more effective at preventing them. But for prevention to work, we need a shared understanding of the risks of leakage and peristomal skin complications, as well as a method for identifying and mitigating them. During the past 2.5 years, we have worked closely with stoma care nurses and specialists to develop the risk factor model. The purpose of the model is to help identify risks that can lead to peristomal skin complications and guide prevention and practice in stoma care. When it comes to identifying potential risks, the risk factor model focuses on 3 key areas: healthcare system, individual with a stoma, and stoma product. The risk factor model has been developed in close collaboration with the Coloplast Skin Expert Panel, the Global Coloplast Ostomy Forum Group, and 18 national COF groups representing 14 different countries. First, we collected experience-based knowledge from stoma care specialists in 18 countries. Then, we evaluated all of this data according to a literature review stating level of evidence. Finally, we used a modified Delphi process to reach a 100% consensus agreement on how to assess risks. This process involved 4,500 online survey responses from over 35 countries across 6 continents. By identifying risks, we can become better at preventing peristomal skin complications. And by preventing them, we can help to restore confidence and make life easier for people living with a stoma.
It is evidence-based knowledge that skin issues in stoma care are still major problems. Many people are not aware of it or try to ignore it, thinking that is what you can expect, and don't seek help. Leakage is very often connected with that. We do know from Ostomy Life study that about 90% are worrying about leakages, some more than others, of course. Stoma-related issues and challenging peristomal body profile are mentioned by 80% of the nurses responding to the Ostomy Life study 2019 as a reason for getting skin issues as well as leakage. Leakages and worrying about leakages can indeed lead to bad quality of life. That influences their work life, social life, sleep, etc., and can cause social isolation. In 2009, Nübig published a case control study of risk factors stating that less than 43% of patients with a diagnosed skin problems were aware of the problem. Less than 16% had sought treatment for their skin problem. Ileostomies, stomas in general with leakage problems, and in patients with body mass index over 30 were associated with skin problems. In conclusion, ileostomy, leakage, and obesity predisposed patients to peristomal skin problems. Other suggested risk factors appeared to be weak or insignificant. Patients underreported the presence of peristomal skin problems. The risk factor model should be seen as a tool to guiding practice for us healthcare professionals. Working with the risk factor model is a systematic way of assessing people with a stoma. It is not that there's anything new really. Most stoma care nurses are aware of all the risk factors, but using the model is a way of being better at finding a suitable product that fits the body from the very beginning post-surgery. And by that, hopefully avoid some of the uncertainty among our patients with lack of confidence in products. In stoma care, there has probably been far too much trial and error for too long. Putting words on all the risks also makes it easier to teach our patients and other caregivers. And we have always struggled finding a common language in stoma care. This model can help us do that. So, using it in every meeting with a patient with a stoma is hopefully a step forward to better quality of life. I believe so.